Welcome back to my channel, beautiful people. What causes painful menstruation? We call it painful urination or dysuria. Most people will experience painful menstruation at least once in their lifetime. It may hurt at the end of it when you pee because of a urinary tract infection or a sexually transmitted infection. But there are various other causes of painful menstruation or urination, which include inflammation of the bladder, irritation of the genital area, or rarely bladder cancer. Painful urination could be a sign of so many different conditions, some of which may require immediate treatment. A quick visit to your healthcare provider can help you to diagnose and, of course, instantly recommend the required treatment. Number one cause is urinary tract infection. Number two is sexually transmitted infections like chlamydia, genital herpes, herpes, gonorrhea, trichomoniasis, which can make it hard to pee. There is something we call bacterial vaginosis. It's common in women. It's a vaginal infection in women. And when we're talking about this, it's very common in people that are sexually active than those who have never had sex. And I want you to know that this has to do with imbalance between the healthy and harmful bacteria that naturally reside in the vagina. And apart from that, we have something we call douching. Douching and having sex with a new partner or with multiple sex partners seems to increase a person's risk of painful menstruation. And of course, we have cystitis, which is, of course, the inflammation of the bladder, which can trigger a wide range of pain during menstruation. And it's also a bacterial infection. But it's not all the cases that is due to bacterial infection. And of course, we have irritable contact dermatitis. Irritable contact dermatitis causes the skin to become inflamed, red, or sore after contact with substances like detergent, soap, fabric softener, sprays, creams, and all that. Then, of course, kidney infection can also make it happen. A urinary tract infection can move into the kidney. If it does when you pee, you have got blood in your urine, and of course you can have back pain. It can be kidney stones or bladder stone. These stones are minerals in the urine that sticks together and crystallize. They can settle down in the kidney or the bladder. And if it is possible for stones to cause no symptoms, pass times unnoticed when you pee. Urine flow can be blocked and become painful if a kidney stone lodges in the wrong place, or even the bladder stone irritate the bladder lining. Then there are some medications, of course, certain medications, such as those that we use to treat bladder cancer, they can cause painful menstruation. And these medications can cause irritation and inflammation of the tissues that lie inside the bladder. Then there's something we call ovarian cyst. They are fluid-filled sac that have developed in or on the ovaries and are among the commonly benign, non-cancerous growth. They affect people who ovulate during childbearing years and often go away most of the time without treatment. Then there's something we call prostate infection. Prostate gland is located below the bladder in male, and what do? They make fluid that carries semen. It can happen if there is an infection. Then we have prostatitis, an inflammation of the prostate, which can develop from a bacterial infection and cause a painful urination. Then at times vaginal tears, you might develop small abrasion, which can cause painful urination if you are not quite lubricated enough when having penetrative sex. Then bladder cancer starts in the tissue that lines the bladder and can spread upward, which can cause problem. In conclusion, both male and female can develop painful menstruation or urination, whatever. The causes and symptoms may differ based on their anatomical difference, the structure of each. But urinary tract infection, for example, most affect females. This is because the urethra is shorter in females, making it easier for bacteria to infect the urinary tract. Of course, female can also develop pelvic pain because when they have an infection or irritation that causes painful menstruation. But while males are less likely to develop pain in the prostate, are more likely to develop pain in the prostate, in the penis, or the scrotum. Whichever way If you see any discharge in your when you are menstruating or urinating or peeing, it is better to see your doctor. See you in the next video.